Hello, it's Dr. Ganaway. I help people get back to spending time with their kids and grandkids through regenerative medicine procedures, manual therapy, nutrition, herbal medicine, lab optimization, a number of other things. As a survivor from falling off a 100-foot cliff, I have really honed in on joint pain and maximal joint function and prevention. Musculoskeletal disorders for sure. So today I'm going to be talking about how do you prevent joint pain or decrease joint pain if you have it. This isn't going to be medical advice because you always have to have that one-on-one with someone for them to be able to assess what's safe for you. There's little things like I'll be talking about omega-3 fatty acids, and so they're safe for most people, but when you get into like let's say somebody's on a blood thinner and that's being carefully monitored, or somebody's like going into surgery and for a short period of time they need to decrease how much their blood thins, it might not be safe. So that's where that one-on-one is so vitally important. But I'm going to give some general information for your education, and I hope that serves you well. So first off, there's always diet. Diet is so important. I definitely know this because I struggled with a lot of pain before. And so partially diet is about controlling the pain, and partially diet is about regenerating it, the body, and having all the materials you need. So when you have a diet, which is like, your body weight in grams of protein a day, which I know some people aren't going to go all the way with that, but hey, I go way beyond that every day, but I have to, got to make sure I am getting healthier and healthier. And that's what's allowed me to be healthier than most people my age and to look younger, despite the fact that I had some serious major injuries that were quite visible to start with. So when we look at that protein, that gives us a nice steady stream of blood sugar that's not fluctuating, so we're not getting fat just glomming onto different areas so much. It also gives us good muscle strength that's stable. So especially in compromised areas where the joints, like let's say the weight-bearing joints, have issues because they're having to have so much weight on them, or the fingers are these joints where it's like hard for the circulation to get out to them, and that can cause issues. Having that protein is going to make sure that those joints can stay healthier by having the muscle strength around them to stabilize them. And then there's the carbohydrates. So carbohydrates, to a large degree, we don't need much. In childhood, you need a little bit more than adults. But complex carbohydrates, I typically tell somebody stick to 1 serving a day at most. If you have extreme pain, maybe you even cut that out. You're going to be able to get, carbs from vegetables, which I tell people not to count unless they're, looking at the starchy vegetables like the corn, the sweet potato, the yams, which are basically like, cut those out. That'd be great. But complex carbs, what does that mean? So that means like quinoa or brown rice but not white rice, or steel cut oatmeal but not quick oats. But 1 serving a day at most, and then the dairy and the fruit to 1 serving a day at most is going to be really important for controlling pain. And I know this is all a lot of things you hear if you've been following me on some of my other social media, but I will get into more particular details for joint pain specifically. And then keep cutting out those sugars, those simple carbohydrates like the pastas, the breads, and all that stuff, and making sure you have enough vegetables. But with joint pain, you want to avoid the nightshades if you can, because most people that's going to cause an inflammatory reaction. So that's like, the nightshades include the tomatoes, the bell peppers, the eggplants, the potatoes. Those are the major ones, and the hot peppers that can flare that pain. And then, you've cut down those simple carbohydrates and sugars and maybe completely cut them out and kept the fruit, dairy, and complex carbs down to 1 serving a day of each at most. Then you don't have all that inflammation going on, because those do get converted into the inflammatory fats, which contribute to pain and can make a huge difference in how much you're regenerating and then what your experience is. So it's like, if you're in a ton of pain, what's the likelihood that you're going to be taking care of that joint as well? It can cause depression, cause fatigue. It wears the body out. And then we get into exercise. So there's aerobic exercise and there's resistance. So like you want to make sure the area is getting movement. So blood is flushing in and out of the area. The synovial fluid's getting clean. Toxins are getting out of that joint. Crystals aren't forming. But you also want strength training because you want to make sure you have muscle strength around those areas to make sure that you have stable joints that aren't going to be so susceptible to damage and pain. And so when you look at certain things are like autoimmune, more psoriatic arthritis or rheumatoid arthritis. We tend to think of like the fingers with that. And so the diet stuff is about the same really when it comes down to it. Though there's certain, there are autoimmune conditions. You're more likely to have more than one autoimmune condition if you have an autoimmune condition, but that'll be another talk because that gets pretty complicated. But keeping those carbs down low, because there are studies showing that that will increase your rate of antibodies. And if you have a lot of carbs in your diet, there's going to be plenty of raw materials to make a lot of inflammation happen and a lot of attack to your own body, because that autoimmune, that antibody attaches to your cell, then it triggers an inflammatory cascade. If there aren't enough materials to cause huge amounts of inflammation, there's going to be less damage. And so with patients, I will also use like local products sometimes that are absorbed right to the area, but that'll either be, more for a one-on-one consultation, but you always feel free to make an appointment if you want. 503-828-9265. But back to what we're talking about. So with the fingers, so it's like you think of like they've got those balls, you can get the squishy balls, and that gives you some resistance. And then there's like particular exercises you can do with like these bands that are made for exercise, so you can get particular movements in. I do really encourage people to see a physical therapist for that, because there's a lot of little tiny muscles in here and a lot of specifics about the movement that are really important. It's just like when people have neck issues like bulging discs, like having very specific physical therapy is very important. Then when we look at the weight-bearing joints, we want to look at, are you using exercise that's also having high impact? So if you're running bang, 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 bang on your hips, on your knees, on your ankles, on your feet, you need a lot of lubrication for that. So some people, they might say, well, that's what I really love to do. Maybe they really make sure their omega-3s are really up and they've got all the raw materials to have a lot of joint lubrication. They get away with it. But if the joints are starting to wear away, they might want to look at like, can I switch to using an elliptical where you've got that smooth glide, but that same motion, or biking if they're feeling like stable to do that. Because I know it's like, you don't want to have falls, especially if you're looking at this video and you're like in a, you have osteoarthritis, but you have osteoporosis as well, and your bones are more likely to fracture. But strength training your joints and strength training in general gives you more muscle mass, makes your bones stronger because they've got that physical pull that mechanically tells the bone that it's got to stay strong. And so, so an elliptical might be what you do, or you might bike if you feel steady doing that. Another great thing is Tai Chi. Tai Chi, more so for osteoarthritis, has had actual studies on it that are very well show that it helps. The horse stance with that, you'll look online, you might see people that have their knees out like way far, like they're a gymnastics specialist. But that's not what somebody's trying to do in general. Maybe if that's something somebody does Qigong or Tai Chi daily for decades, they might have that kind of very, very wide stance and have it be what's wanted. But the important thing is that the knees are hip width apart generally, and that the knees are not buckling in, and that person's coming down into the their pelvis is coming down to a seated position. So that's why you'd want to like participate in a Tai Chi class, because then you have an instructor that's going to show you how to do that properly. I want to post a video at some point about how to do the horse dance, but that one-on-one is going to be so important. There's so many little things that we don't realize we're doing in our motions, and Tai Chi is really great for that, because usually the instructor can come up and be like, oh, your head's not straight because this point has to be where it is. And even there, I wasn't standing quite straight, but when you learn those principles, then you'll be using your body in a correct way to strengthen the knees to where they need to go, but then also you get some tendon strength if you have a really good instructor, because they'll teach you all the little aspects of that movement, the horse dance. And with pain, there often is a good amount of depression. In my link on my Instagram at Dr. Ganaway, or Dr. Emily Ganaway. Well, just go and get on my email list and you'll get it eventually anyway. But there are a lot of things that are important as far as making sure you're exercising in a community can be really helpful, just to get that group encouragement and to help get over the pain with other people around. It can be easier to exercise through pain. If you're having issues where there's joint problems, where you're getting muscle weakness, then you are going to want to, like where you kind of drop to the ground suddenly or things like that, then it's like, this is time to see a doctor to see about getting a surgical referral, because you might need urgent care, or you might even want to go to the urgent care if you just fell over all of a sudden or losing strength in that kind of muscle weakness kind of way. But in general, like your joint isn't very healthy, so you need to get more muscle strength around it, having that community around it, and having that guidance. I mean, certainly if you can afford it, one-on-one coaching is fantastic, but a Tai Chi class is often a great way. And for me, it was really powerful to have like Qigong and Tai Chi, because there is so much you learn about your body and how you're standing, and strengthening all your little joints in those classes. And then having that community is really important when, like, for me, it was easier to do more in a group setting than I might be able to do on my own when I'm just there with me and my pain, which, you want to strength train, you want to eat right, you want to do these things, because now I'm healthier than most people my age. And it's because I did what I need to do. So with that, it's like you can use the machines to get some good strength without weight bearing. And then there's things like hydrotherapy. Hydrotherapy is different kinds of techniques where you utilize thermoregulation in the body based on how it interacts with temperature that we get through water. So very specific to water. There are different kinds of hydrotherapy, but here I'm going to be talking about basic hydrotherapy for joint health, which is different than some of the things like where you take a warm shower and end with cold in the winter if you're not sick, to make your immune system work better as far as preventing getting illness from other people. But here we're talking about hydrotherapy for flushing the joints and getting good immune cells into the area to work on the area. And that is alternating hot and cold hydrotherapy. So this can be done sometimes with washcloths, sometimes with bowls. You just need that actual water there. And if you have a hot tub and a pool, fantastic, because that's a really, really easy way, because it's all prepped and ready to go for you. And so, like with the hands, a couple bowls of pretty warm water or pretty cold water, or you could even use your shower head to do this. But you submerge the hands in the warm water for 2 minutes, and then right afterwards you go into the bowls with cold water for 30 seconds, directly followed by 2 minutes warm water, 30 seconds in cold, directly followed by 2 minutes in warm water, 30 seconds in cold. So that's really important, that ratio of time, and it's directly after each other. So at least 3 cycles of 2 minutes in warm water, 30 seconds in cold water, or like a washcloth that has got a good amount of water, maybe slightly wringed out over the areas. And you can use the shower head, or if it's like you've got more hip, knee, ankle, that kind of stuff, then you might use like hot tub or pool, or just the shower head would be pretty easy to switch the dials from hot to cold. Pretty warm, because some people do have issues with not being able to perceive temperature, so they might make the water too warm for themselves, and you want to be careful about that, like diabetics. But in general, it's not supposed to be scalding hot. You don't want to damage your skin, but pretty warm. You want a good temperature difference, and that's going to drive macrophages, so little immune cells, to go into areas and eat up basically the gunk that's not supposed to be there, and flush out the area and get circulation to come in and out of the area to decongest, which is all very important for joint health. It can make a big difference. And then there's omega-3 fatty acids. So like I said previously, with all of this, you want to consult a doctor, somebody that you're seeing one-on-one, to make sure that you're doing what's good for you. So with omega-3 fatty acids, very safe for most people. But if you were on there's issues with blood thinning and that kind of thing, somebody will have considerations that their doctor will have to address with them as to whether or not they should be taking that, or if they're going into surgery in the near future, just got out of surgery. There's particular time periods where the people have to be mindful. But in general population, like, the recommendation would be 3,000 milligrams of omega-3 fatty acids a day. And with joint pain, somebody might go significantly higher than that. So it's like fish oil or chia seeds are good sources of omega-3 fatty acids. And there's collagen. So a lot of people will do bone broth, or they'll just get collagen as a supplement. And if somebody's vegan, they're not going to have direct collagen, though I guess it can physically be made from bacteria or fungi, which some people would consider vegan or not, though that's not readily available. But having all the amino acids that are necessary to make collagen, having plenty of vitamin C is really important. And looking at the fact that glycine, proline, hydroxyproline are 57% of the amino acids for collagen is important. And then having the vitamin C is important for joint health. It's very important to make sure our cells have stability, and there's a lot of different little issues why you want to make sure you have enough vitamin C, which some people will end up supplementing, especially if they're easy bruisers or they don't have enough iron, and it is because they haven't had the vitamin C to absorb it. And that gets kind of into the lab issue as to what can contribute to joint pain starting to happen or getting worse. Because you'd ideally have your provider look at your ferritin levels, so your iron stores. That level can be falsely elevated from inflammation, so somebody having a lot of carbohydrates, so it's like somebody can get on a really healthy diet and then get that checked, then that's fantastic. Because then they're going to have more of an accurate idea of their iron stores and be like, oh, okay, if they don't have enough iron, I need to get enough iron so my body can have enough functional red blood cells to get to all the areas, like my extremities, from my joints and my spine and all of that, to keep those joints healthy. Because the joints, compared to your organs, have kind of compromised circulation, especially your heart and lungs are number one. But then if you stop having enough blood flow to everywhere, your joints are going to be one of the first places to get cut off. And so having that ferritin checked, having a CBC to see if you have blatant anemia, but remembering that that's looking per volume. So if somebody has really low blood volume, they're not going to have enough to get to these areas that are important. That's why the ferritin is very important to have checked, and making sure it's does this person need a B complex? Does it need to be methylated, like the B12 and the folate? Because there's a huge portion of the population that has defects in some of their enzymes to at the methyl group, which I don't want to get too complicated, but basically a lot of people have been very, very healthy, very, very happy that I've put them on a methylated B complex because it can make a big difference in their lives. Then having thyroid checked, because if thyroid is low, that's your go hormone. That's going to make everything go and move. That's like why the thyroid hormone speeds up the bowels. Thyroid hormone gives you more muscle strength. Thyroid hormone wakes you up. Thyroid hormone does all these go things. And so if it starts getting low, somebody is more likely to have compromised blood flow to their joints and have issues with their joints and not be moving around as much and have joint problems. And then having hormones checked. So especially when it's like you start reaching these later decades in life, like perimenopause, menopause, andropause, and all of that, because testosterone is really important for muscle mass. And even women, it's like we need a certain amount of testosterone to be able to function. And it's not all about necessarily replacing with latent hormones, but sometimes it's more about giving what the body needs to have that message or the raw materials to make the hormones. And with testosterone, with women, it's coming mostly from the brain, and with men, testes and that kind of thing. So I guess that's a more complicated conversation, but that's why you want to see a medical provider, a naturopath if you have one in your area is really important, because they have a good amount of more training around that kind of optimizing lab values and interpreting like a full hormone panel and a full thyroid panel. It's just part of their training. And then looking at like estrogen, that's elasticity in the tissues. And so it's like certain parts of the cycle that goes down for women, but then you get into that perimenopause, menopause, and it goes down, and that affects all kinds of tissues. So like the joints, that affects the blood vessels, that affects the skin, and all kinds of things. That's why like older women, instead of getting this pinch like this, it might look like more like paper if they've been low in estrogen for a while. But that's what's happening in the joints too. You don't want that. And then progesterone affects basically water metabolism throughout the body when we look at it outside of just what it does in the reproductive years trying to get pregnant situation. And with that, it's like, well, is your body getting kind of boggy and not working quite right? A lot of people really notice it as like that brain fog with older age, especially the women will notice that. So getting that full hormone panel can make quite a difference in seeing what can be done. And like there are synthetic hormones, and a lot of people don't understand that is quite different than getting a bioidentical hormone replacement. And I will always recommend a transdermal bioidentical hormone that is rhythmically administered for multiple reasons, because hormones have to go up and down for particular reasons. If I feel that's something somebody can follow along with, though sometimes somebody needs a little bit of easing along, if hormones are appropriate for that person, because the transdermal is going to go into the body in a way that isn't going to get metabolized into byproducts that are kind of trash before they even hit the body. But that's, only for certain people have to worry about that kind of thing. But overall, so we want to make sure we're having the diet on track, exercise on track. Hydrotherapy is typically a really great idea. Then there's massage. So when we look at osteoarthritis, they looked at low pressure massage versus moderate pressure massage, and moderate pressure massage did better for lowering pain levels and improving function. And then you look at certain things, like people like, oh, I just touched my fingers and they hurt, or I think of people have had that fibromyalgia, when you get into certain areas and it's very crunchy. And on June 13th, I will be talking at TriOasis in Portland, Oregon, on things you can do to kind of change that whole thing, because people can't massage deep into that without causing pain, because there's typically, unless somebody's losing healing in some areas because there's so much dysfunction going on in there. But that massage is going to help flush things out, get things moving. But sometimes people do need a little bit more like extracorporeal wave or injection therapy. But I will talk about that at the June 13th event at Tri-Oasis in Portland, Oregon. So use the link in the site if you want to attend. There's limited seating, so you just have to know ahead of time. There's a tiny charge for coming just to make sure we're all surrounded by people that are really interested in the topic. And also there's a link in the description here on regenerative medicine prep. And so that gets into a lot of the information I talked about today, but kind of written out, easy pinpoint way. So I hope you enjoyed. Remember, diet's important, exercise is important, hydrotherapy. Sometimes we need some supplementation, and labs are always going to be important. But make sure you consult with your doctor. If you're in the area, feel free to give us a call at 503-828-9265 to set up an appointment at MediPro Holistic Health in Beaverton, Oregon. Take care. Bye.